Well, I keep coming to Ukraine because I love Ukraine. This is a beautiful country. People have a strong sense of identity, of culture, of history, of pride of their country, and of resiliency, and the determination to win this disaster and this war is palpable everywhere you go. So I believe, in addition to our role as physicians who provide training and provide medical support, we have a bigger role probably, which is to advocate on behalf of the population of Ukraine, of the civilians, of the doctors, of the nurses in our homeland, in the United States, so people get to know those stories that we are witnessing, and so that way they can sympathize with the people of Ukraine, and that will be translated in more assistance to Ukraine to overcome this war.
Hey Mike, welcome to Shashau.
Thank you. My first time going to Ukraine, and I'm happy to be joining the medical mission with MedGlobal.
I'm Dr. Michael Samotowka, board-certified trauma surgeon, surgical critical care, and I work as a trauma surgeon and surgical ICU doctor in the United States. My parents are from Ukraine. I was born in America, and I joined MedGlobal about 3 years ago, and working to help the people of Ukraine during these hard times. So this current mission, we're in Lviv. We've got a group of 65 students, surgeons, who have come for training in trauma surgery and critical care. We also provide some surgical and medical supplies as part of our program. And MedGlobal, what we're trying to do is get everybody on the same level of training and experience, and provide the best care that we can for the Ukrainian people. And to also have them know morally and spiritually we support them, we're here for them.
This is like World War I medicine. It's trench warfare. You're going across no man's land, but you've also got drones in the air around you. Evacuation times are long. These would, the cases that I have seen in Ukraine and the patients I've helped operate on are extremely challenging. You know, they would be challenging in the best of our medical systems in the States. The kind of problems they've got, infections, antibiotic resistance, the extremities, the bone loss, just everything is very, very difficult. And if I can make a difference with that, that's why I like to come. You know, we collect lots of medical equipment and bring it to Ukraine. And we bring boxes and boxes and boxes, and we often, most of the time, just pay for that out of our own pocket to bring the medical supplies to Ukraine that we can then send to the other hospitals in Zaporizhzhia or Dnipro or Kharkiv or Kherson or Odessa, places that are taking care of the soldiers.
We have a team in Ukraine, we have a local team in Kiev and Lviv, and our staff plan and prepare for these missions, training missions. We are expanding our programs, and we would like to stay in Ukraine after the war to help in the rebuilding of the healthcare system after the victory.
I think the most important thing in every country is not the money, it's not the land, it's the people. So when the volunteers, when doctors, trauma surgeons from US come here, they've got a lot of experience in all parts of the world, and their knowledge can save lives.
Our course covers all days of lecture in which we touch on the major topics in trauma surgery, mass casualties, properly triaging patients, the basics of trauma surgery care. And then the following day we go through an anatomy dissection using a pig model, and we basically go through the various organ injuries and what the best approaches are for treating those injuries and what the options are.
The most astonishing thing is that when you come to Ukraine, and this is my 6th trip, you see life as usual. People are adapted now to the war. So you go to the hospital, it's like any other hospital in Chicago or in the United States. They deal with the same issues that we deal. But of course, in the background, you know that part of the patients that they are dealing with are trauma patients who were injured in the front lines, or civilians who were injured because of the bombing, or that they lost member of their family, or they have mental health trauma because of the war and the uncertainty and the displacement. But they are quite resilient, they are quite educated. What I've noticed among Ukrainian doctors and surgeons and nurses, that they want to learn, and they are like a sponge. They absorb knowledge, and they come to these courses. And even though that this is the third year and after the war, that we still have large number of surgeons and doctors who come to these courses.
It's very rare to have a country that has this whole energy of wanting to, maybe an energy of inspiration. Everyone is inspired to push further and forward and wanting to create and wanting to progress. Not like that in the US or the UK, it's not like that. People are very much set and comfortable in their ways. Ukraine has this spirit about it, and it's inspiring me, and I know it's inspired a lot of people who come here to want to help.
We're building a foundation of trauma surgery education in this country that Ukraine can use to grow the profession. And by the Ministry of Health and Ministry of Defense, I believe that they've agreed now to identify trauma surgery as a separate field of surgery and to develop further experience in that field.
So the purpose of this Resiliency Medical Missions, and we call it Resiliency Medical Missions because it builds resiliency within the local community. So doctors and surgeons can weather the storm, can deal with the influx of trauma patients, or develop skills that are needed to deal with mass casualties and other issues.
Some surgeons come here to operate and help out with the operations, but I think if we can train surgeons to do a better job at dealing with these severe injuries, in the long run, that'll be a broader improvement in the care for the trauma patients.
It almost makes it impossible to leave because we're all working side by side. So that's, I guess, what has made me feel inspired to keep working here.
A good group of people that we pull together every time to come teach this. And the students who come every day come with an idea that they want to learn as much as they can. And so even though the days are long, I think people are fairly glad that they came to this course and walk away having picked up some new skills, some new ideas, and some link to an outside world that knows that they're here, they're working hard, and that we do care about them and what's happening here.
It's a lot of opportunity for us, and it's exciting because we have some information from them. We have opportunity to learn from them and succeed in our profession.
Our organization was one of the very first to put boots on the ground to assess the situation. We've set up several programs with trauma surgery, nursing training, psychiatric care.
We've trained more than 4,000 doctors and nurses and medics from 18 oblasts in Ukraine, from more than 100 different hospitals. And these trainings are quite diverse. And the purpose of these trainings is to provide resiliency to the local healthcare providers and the nurses and the medics, so they can deal with a war situation, with the influx of large trauma patients, with mass casualties, with wound care, with amputations, with infections, and all of the issues that comes with war and disasters. So this is one of the medical missions that we are leading.
The whole gamut, so to speak, on providing assistance to Ukraine, and we've made it very clear that we're here for the long term. We'll be here 5 years, 10 years, 20 years down the road, providing assistance as needed.
So one of the key reasons why I've worked directly with the hospital union here in Lviv, they reached out and said, we really need help working with infections. So through my project management skills in the past, my Master of Disaster Medicine and my postgraduate qualifications in clinical redesign, I was able to bring those skills to the hospital, and we were able to come together and form like an infectious disease department with epidemiologists, microbiologists, clinical pharmacists, infectious disease doctors, and we were able to work directly with the war-wounded patients to help better treat their infections, to get them from their acute state through to rehabilitation a lot faster.
We also provide sustainable medical programs that are helpful to the local community based on the priorities of the local communities.
I first came to Lviv and worked at the St. Panteleimon Hospital and St. Luke's Hospital, part of the First Lviv Medical Union. And later made contacts with academic professors of anesthesia at the universities in Dnipro and Zaporizhia, and I visited hospitals all over Ukraine, mainly teaching anesthesiologists ultrasonography, point-of-care ultrasonography, but also giving lectures about blood transfusion, about whole blood, damage control, resuscitation, and other subjects relevant to taking care of war-injured patients. So the training that I have mainly done is ultrasound training, which is a diagnostic method. So it's teaching them how to make a diagnosis. And oftentimes I think that if the doctors learn these techniques, they can make a diagnosis quicker, decide what kind of shock the patient's in, treat the shock appropriately, which could increase the survival of the patients.
We have a mobile clinic in Kharkiv right now that's providing medical care for patients who have chronic conditions who are at the front line because there's shortage of medical providers in Kharkiv Oblast. And also we support the healthcare system to recover after the war. So all of this, what we do in Ukraine, but what's more important thing is to partner with the local community. So localization is something that we embrace to heart. So what is important to the local community is important to us. And doctors have told us that they needed to be trained on certain skills, whether it's portable ultrasound or mass casualty or dealing with trauma patients or chemical weapons attack, and that's what we are doing this kind of training.
Дуже гарно перейшов курс, було дуже добре навчання, бачили, що вони знають, ми з ними спілкували, говорили, вони показували нам, як вони роблять, і дуже практичний, дуже добрий день для нас всіх.
We had some people who were very advanced and some people who were kind of in the middle, and I think they all learned from each other. And we've made a couple urologists out of our general surgeons today by taking out the kidney and fixing the ureter and fixing the bladder. So I think it was a good day. But if you look around, our table is the last one working, so I'm clearly the slowest instructor that there is.
Наші спікери діляться своїм власним досвідом і навіть вони кажуть, що ще не все задокументували в книжках, не всі свої рекомендації, тому це з перших вуст, і це досить цінно.
Хочемо подякувати за теоретичну частину. Вони гарно зробили теоретична частина і практична частина. Тобто показали багато травматичних ушкоджень, які можуть бути в людини там, при вогнепальному, при осколковому пораненні, крупні судини, серце, легені, живіт. Тобто був день теорії, а сьогодні у нас день практики, 5 станцій, на яких показують різні ушкодження, хірургічні, травматологічні, також торакальна хірургія тут є.
Дуже багато обговорюється важливих речей, як нам себе поводити з приводу тактики лікувальної, та й взагалі міжнародна підтримка для нас є дуже важливою.
Цей курс важливий для того, щоб іноземні лікарі, які вже мали досвід на попередніх війнах, поділилися ним, допомогли краще лікувати, щоб було менше ускладнень, щоб було ефективне наше лікування. Тобто постійно треба вчитися, нові методики використовувати. Знову ж таки, є антибіотикорезистентність, проявляється за вже 4 роки війни, все важче і важче лікувати пацієнтів.
You can donate to MedGlobal at www.medglobal.org to Ukraine and other programs, and your donation will be translated into saving lives.